Thank you for joining us. I'm Mary Yanez, Director of the Senior Adult Program at the El Paso Community College. And of course, this is Mature Living. We come to you weekly for the past 31 years. And we also love to bring you information about wellness, about staying healthy, about the important things that we need to pay attention to as we grow older. So we've invited Dr. Diego de la Mora. He's a physician with Village Medical. And he's going to talk to us today a little bit about himself, because we haven't met him yet, and also about the concept of Village Medical. So welcome, Dr. de la Mora. Thank you for being here. And I know you're busy taking the time.
Thank you for having me.
You're also the director, right? The medical director for Village Medical?
Yes, I have the pleasure to be the senior medical director for Village Medical in the El Paso market.
Super. A new concept, I know. But first, we always like to get to know our doctors, right? And, you know, I do anyway, and I'm sure that maybe some of our viewers.
Absolutely.
Who is Dr. Diego de la Mora?
Well, I grew up in Ciudad Juarez. I was born here in El Paso. I grew up in Ciudad Juarez. I moved to Dallas to do my college, medical school, and my residency. And then I moved back home. I was back in El Paso in 2013. I was an assistant professor at Texas Tech for close to 9 years. And an opportunity came to join Village, which is a wonderful organization with very innovative concepts of how to take care of patients. And I love that. So I decided to join Village about a year ago. I'm located at the clinic in the Mission Valley neighborhood, which is around Yarborough and North Loop.
Yes, and you have multiple doctors in your team, your physicians, and you have several clinics, and other doctors are at other clinics as attending your patients.
Yes, we certainly work as a team. Village Medical has grown in the last 2 years here in the El Paso area, and we have 6 locations now. We have a location in Monwood and Zaragoza, the Walgreens in Monwood and Zaragoza. We have another location at the Walgreens in George Dieter and Pebble Hills. Another one in the Walgreens in Montana and Chelsea. And then in the Northeast, we're at the Walgreens that is in the Rushing Street and Fairbanks. And then we have another one that is a freestanding Village Medical in South Mesa Hills.
You passed the test. That was a tough question because you had to go all over El Paso, Northeast, and Mission Valley and West Side. You have them all over the place. Now, our topic today is to talk about the Medicare annual wellness visit. What is that, and tell me a little bit about that, and also why is it important?
Well, the annual wellness visit is a visit that is paid by Medicare and at no additional cost to Medicare beneficiaries. And it's a very important visit because we focus on the patient's preventive services. It takes about 30 to 45 minutes to complete, and we certainly encourage all patients to have that visit with their primary care physician or the primary care team. The idea is that at the end of that visit, there's a conversation with the provider regarding dietary changes that need to happen, produce a care plan for the next 5 to 10 years of all the preventive needs, address any issues with updating and being up to date with all your immunizations, and overall try to assess all the medication lists, making sure that all the medications are well documented and that we are coordinating the care across all the care team, all the different providers and physicians that may be taking care of the patient.
And so you also have physician's assistants in your team?
Yes.
And so who can give you this? Who can perform this wellness?
Very important, yes. So it is very important that the primary care team is the one that takes care of the annual wellness visit, because the goal is to create a plan that's going to work long term, right? So we want to make sure that the primary care team takes care of that annual wellness visit. It could be the primary care physician, It could also be a nurse practitioner or a physician assistant that works in team with the primary care physician.
Great. That's so many insurances that we have to deal with. And I'm wondering, do most insurances cover this annual visit?
Yes. That's
is it different than a medical check, an annual medical check? Is it different?
Yes. Thank you very much for asking. The annual wellness visit is covered by Medicare. So all beneficiaries of Medicare will have coverage at no additional cost for the Medicare annual wellness visit. Most commercial insurances will also cover something similar to the annual wellness visit that we usually think about as a annual physical exam.
Okay.
But it is important to mention that the annual physical exam and the Medicare annual wellness visit are not exactly the same. The annual wellness visit does not necessarily mean that patient is going to have sort of a hands-on exam. It's more focused on talking with the patient about all the preventive services and making sure that we create that long-term care plan.
Okay. So as a new patient, anybody considering if they're looking for a primary care physician, and all of us have to have a primary care physician, somebody that we can go to for colds or stomach aches or whatever we have that comes to us every so often, and so we need to have that primary care physician, but then there's referrals to specialists, right, as well.
Yes.
So everybody has to have that PCP.
Absolutely. We highly recommend that everybody has a primary care physician or a primary care physician team that addresses all the chronic conditions, makes sure that the vaccinations are up to date, the cancer screenings are up to date, all of the things that we need to do, flu shots, etc. Exactly. That's something that is unique in the way Village Medical practices. We are happy to serve as the primary care physician, and we make slots available for our patients in case that they need to be seen that same day. There are times where maybe patients may not be able to see me, for example, but they may be able to see someone in my team at the same clinic. We make sure that we have slots available for them to be seen whenever they need to be seen.
That is so convenient. And the different locations, and even though maybe we go to the Walgreens facility to see our doctor, we can always get our prescriptions near our home, wherever. There's no problem with that.
Yes.
Yes, go ahead, doctor.
Sorry to interrupt. Another important thing is we're open 7 a.m. to 7 p.m. Monday through Friday, and we're also available on Saturdays and Sundays. Most of our clinics open 9 to 5 on Saturdays and Sundays.
That is a super thing to know.
Yes.
We're always looking we don't have to wait till Monday, if something comes up on Friday. It's so good. I really like that. And, also at the time when we're doing this wellness visit, can we talk about other things that are other issues, additional issues is that when we tell our doctor what's going on?
Absolutely. We certainly recommend that if there's any other issues that you want to cover during that visit, that you bring them up with your team. If between you and your care team decide that those issues need to be addressed that day, you can certainly address them. It may fall under different coverage under Medicare, but we believe that it's very important that all of the issues be addressed during that visit.
That's super. That care plan's really good. The locations are excellent. The time that you're open, those extra weekend times is wonderful. And of course, the coordination of care, which is really, really important for the specialized care that we need when we need referrals. And so how do we make an appointment? How does that work?
Well, you can make an appointment directly at our website, villagemedical.com. You will be able to find a location and select the time that works better for you. You can also call us at 915-875-1632.
Yes, that's what I have here. Another test you passed. Yeah, that's the 915-875-1632. 1632. I'm going to have to remember that number because we can call that number and make an appointment, but there's also a website.
That's right. The website allows you to make the visit directly and at your convenience. Village Medical also has a Village Medical app. I know it can be somewhat more complex, but there's a lot of benefits that come with having our Village Medical app, because if you have a question, you can ask a nurse practitioner right there. It does not matter what the hour is. You can ask the question. You can also schedule your visit even if it's after office hours. You don't have to wait until the next day to make your appointment. So
That's right.
That's sort of the convenience of being able to offer our schedule to our patients 24/7.
Very good. And that webpage is www.villagemedical.com. That's so easy. Very good, doctor. I just have a couple minutes left, and I'm wondering, is there something else that we haven't covered that, Village Medical in this community for the past, how many years now since it opened?
So Village Medical opened about 2 years ago. I've been with Village for about a year. It's a wonderful organization. It's a wonderful place to practice and a wonderful place to get care. We can offer primary care services. We're open to walk-ins. And the most important thing about Village is that we take the time to focus on the patient. We are more focused on the value that we provide. Sometimes that requires a little bit more time with patients, and we're willing to spend more time with them, creating that relationship and building those long-term, what we call healing relationships with our patients.
And I can't wait to meet more of your doctors, your physicians there at Village Medical. We're going to meet, in our Spanish show, we're going to interview Dr. Alejandro Ovalle. And I'm sure you have the others. You have Guerra, right?
Yes.
We met him already.
He's wonderful as well.
Yes.
We have a great team of physicians all across town. Dr. Rodriguez is in South Mesa Hills. We have Dr. Ayala, Dr. Cardenas, Dr. Lopez, Hector Lopez, Dr. Del Moral, etc. I can keep going. We have a lot of great doctors all across town.
And we thank them for what they're doing for El Paso and for our community and keeping us healthy and out of hospitals. Very good. Thank you, doctor. Good to meet you, and we wish you great success. We'll see you at the throughout the year.
Thank you very much. We're happy, and thank you very much for having me.
Okay, we'll be back with more guests.
It's understandable to be overwhelmed if you're trying to manage your diabetes on your own. So don't. Know you've got people in your life who want to help. How do you build that support network? Start with your healthcare team. Your doctor can help you build your team, which may include connections to diabetes educators, dietitians, and other specialists. Talk with your family and friends, share your goals with them, and ask for their support. Talk with someone you trust or a mental health professional to help you work through emotions you may experience. Find others who are going through their diabetes journey as well. There are support communities available with folks just like you ready to share their stories. Visit knowdiabetesbyheart.org to hear from our ambassadors. Remember, you're not alone.
Thank you for being here on Mature Living. We want to continue our conversation today about wellness, okay? So we thought about our feet. We thought about the Foot Institute, and we thought that maybe we needed to know about foot care, about the kinds of ailments and issues that we may have with our feet as we take care of our bodies. And so we've invited Dr. Efren De la Rosa, who is with, of course, a founder of the Foot Institute. And thank you for being here, Doctor.
Oh, it's my pleasure. Thank you.
It's always interesting to ask and get to know our doctors, you know. So do you mind if I ask you, tell me a little bit about yourself, where you studied, where you lived?
Sure. Well, an El Pasoan. Okay, I came back home, which was always my goal. Always welcome to come back and serve our own community.
Yes.
But I was born in a vital called San Juan, right here in Central El Paso, so which a lot of people are familiar with that.
Yes, absolutely.
And then I'm a Burgess grad, and then community college and UTEP as well. But I did do my podiatry school in San Francisco, okay, so which was very nice, very different. And then I did 2 years of residency. My first year was at LA County, which is very busy.
Oh, I can imagine.
Yeah, it is. It's a very busy place. And then I did a place near Bakersfield called Delano Regional Medical Center. That's where I did my surgical training.
Wonderful. And then you decided to open up the Foot Institute.
Correct.
How many years ago?
Well, we started in 1994, so I've actually will be in practice 29 years this April, so it's pretty amazing.
Very good. And so it's grown, and maybe at the end of our interview, you can tell us all the different locations,
Sure, absolutely,
and maybe
yeah.
even your plans for the future, so people can be looking out for
Okay,
visiting.
that sounds good.
And tell me a little bit about the importance of taking care of our feet, foot care, basic foot care that we need to pay attention to, especially as we get older.
Well, one of the things I would tell you is that, obviously your feet are important, but you don't really pay attention until they start complaining,
Yes.
Once they start hurting, you're like, oh, wait a minute, they are very important. But one of the things that people have to understand is, pain really shouldn't be a common thing as you get older. I know we all put mileage on our feet, but pain is something that can be addressed. And there's a lot of common ailments. Everything in El Paso, diabetic foot care is extremely important.
Yes.
Okay, and then your common stuff like heel pain, bunions, hammer toes, nail problems, anything like that, we can help you with.
Okay, super. Do most insurances cover visiting the podiatrist?
Yes, and we are on most insurance plans. Okay.
Oh, good, good. So tell me about bunions. I don't know much about them because I haven't had that issue.
Sure.
But many.
That's a
of your
very common
patients-
problem, yeah.
What-
Well, there's a big genetic part of bunions, okay? So, you inherit a lot of stuff, and that unfortunately you inherit the feet as well.
Yes.
But over time, you'll develop the same problems. And a bunion is a big, bump on the side of the big toe joint. And over time, they do progress. So it is important to address them when, if you had kids or they runs in your family, let's address it while they're young because we can rebalance the foot through arch supports. But once you have it, if it hurts you a lot, we do have surgical options to go with that as well.
And is that caused by wearing tight shoes when you're
Well,
little?
it
or-
aggravates it. Okay, so it's a combination, and people tend to wear their shoes too small, and so one of the common things is that it'll cause more pressure on that bunion. It'll cause swelling and pain.
Yes. And it's a little bit of disfiguration on
Well,
your
yeah, the joint dislocates. So we have to, when you do surgery, you have to realign everything basically.
And that's the kind of surgery that you do with your doctors. How many doctors do you have?
We
in your
have 3
practice?
associates, okay? And so we have 4 doctors at the Foot Institute, okay? And we have Dr. Reina Ray, we have Dr. Galindo, and we have Dr. Alvarado as well.
Wow.
Okay.
Well, that's good, and a whole bunch of years of practice of
yeah.
experience,
I'm
right?
the old one of the group, yeah.
I had heel pain. I had the plantar fasciitis.
Plantar fasciitis, correct.
But it went away, thank God.
Okay.
But tell me about pain, heel pain.
Right. So one of the things you inherit is, like I said, you inherit your feet, okay? So if the foot tends to be a little bit stiffer than it should, a lot of times you'll create more pressure than you should. So what happens is you create more pressure on this ligament underneath the heel. It'll stretch out. If it stretches out too much, you will get swelling, and the swelling leads to pain, okay? Now, I think you were very fortunate because a lot of people, it doesn't go away. Once you get swelling, a lot of times you keep recreating the problem. But in your case, apparently it went away, so good for you. There you go.
Yes, good for me, 'cause it was awful. I was in a convention, and I have to share this with you. I was in New Orleans,
Yeah.
and Bourbon Street, and all the walking.
Oh,
and,
yeah.
And I didn't have much fun that
Oh, yeah.
conference because I was in pain.
It hurts, absolutely, absolutely.
So definitely, thank you God for not sending that pain back to me again. Plantar
Absolutely.
fasciitis, and that's a swelling. So
Yeah.
you have to.
Well, you have to
Massages.
address the cause of the problem, and that's usually when you step, the arch collapses and you pull on it. So one of the parts of the treatment is actually using like an arch support, maybe some stretching exercises, and then you have to address the swelling part of that, which would include like icing and things of that nature.
It's good. Well, Well, good. I should have visited you a long time ago. Pain and the ball of the feet is another issue.
Yeah, one of the things, especially with our diabetics, but one of the things, what I tell people is you inherit your shock absorbers and you inherit your tires, okay? So that's
right.
kind of the way I try to explain it, because the stiffer the foot, your shock absorbers don't work well, so you're going to develop problems a little bit earlier than you should.
Yes.
But the other thing is you also inherit your tires. So the question is, did you get the discount tires or the Michelin tires?
Oh,
okay?
yes.
And so one of the things that happens on the ball of the foot is you can actually get some pinched nerves between your bones there, and that can lead to a lot of burning pain on the bottom of your foot and tingling to your toes. And that gets missed a lot. So that's something that we address all the time.
Wow. So I know we're going kind of fast through this, but
It's okay.
eventually I'm going to ask you about that initial interview, that initial exam or assessment. You know, and I'll ask you about that in a little bit.
Okay.
But I don't want to miss any of the main topics that we wanted to ask you about. Diabetic foot care,
Absolutely.
right? Diabetes so prevalent in our community.
Correct.
With our Hispanic community.
Yeah, I'm a board member for the El Paso Center for Diabetes, and I've been on their board for like over 25 years now. So, but they're very a big influence in educating our public here in El Paso about the dangers of diabetes. And with feet, obviously, it's important because we're almost twice the national average here compared to the rest of the nation in diabetes.
Yeah.
So it is a very important topic for us. Unfortunately, we do amputations and things of that nature, but our goal is to avoid all that. And so the good thing is that, you know, if you have Medicare, you know, the insurance will cover, you know, trimming of toenails for if you're diabetic. And we can look at it. We can do vascular examinations. You know, we actually have what's called PAD testing for circulation. Very important. And we can evaluate the foot every couple of months as well. And so one of the things we want to do is prevention is very key in in avoiding any kind of problems in diabetic feet.
And I didn't ask you, but why did you choose foot care for your specialty?
Well, I
being
was
a podiatrist.
well. I've actually been involved in the field since I was 19. So I used to work for two guys that a long time ago, a guy named Dr. Robert Alvarez and Dr. Jesus Ramirez, as a medical assistant. And originally, I was an electrical engineering major, believe it or not.
Oh my gosh!
Yeah.
Right brain, left brain.
Yeah, and but to me, it was very boring. But when I started working for them, I loved working with patients, and that's really. And I thrive on that. And so one of the things I like doing is working with patients, you know, and they become family. Some of them have been with me over 20 years. And now I ended up switching my major, and, well, voila, things changed.
And here you are with 3 clinics all over town.
Yes.
So not only our foot care, but our nails. We hear a lot about all these fungus and different things that people suffer from.
Correct.
Tell me about nail care.
Well, as far as nails are concerned now, you get fungus, okay? A lot of people think that's normal, but it really isn't, okay? And so one of the things that happens normally is the nail gets damaged, the nail separates from the skin, and that allows the fungus to get in. And from there it can spread, but since it doesn't really hurt at the beginning, people think it's normal, okay? But, you know, for a diabetic, especially if it's too thick, it can create a wound underneath the nail bit, okay? So one of the things that we want to do is do prevention. Now, you also have ingrown toenails, which is a very common thing.
Yes,
and
that is what I...
Yeah, and there's a procedure for that as well, you know. So there's different ways to treat the fungus and the ingrown toenails.
Yeah,
you know, you can just...
kind of dig in right on the sides.
Well, you know, for our diabetics, a lot of times we just dig them out. But, you know, there's actually a procedure, a minor procedure that can be done in the office to just remove the side, burn the root so the side doesn't come out anymore.
Oh.
Okay, so that's a good option. For fungus toenails, it's basically going to be either topicals, pills, or we actually have a laser to help treat fungus toenails. So.
Wow.
Yeah.
And so technology has improved in podiatry as well?
Especially, and podiatry, it's everywhere in medicine, but in our clinic we do, one of the things I am very proud of is we have a lot of technology, and I thank my mentor in California for that.
Yes.
He's the one that taught me which way to go. But we do have everything from x-rays, we do our own ultrasounds, we have our own CAT scan, we have our own MRI. We have a laser for pain. We have a laser for nails. We have shockwave therapy. I mean, I could go on and on, but we have quite a few things available.
That is so good. In a nutshell, we need to take care of our feet. We need to make sure that we get that checkup.
Absolutely.
That initial assessment. Okay, what's going on with you, and how long, and why did you wait?
Yeah.
So long.
Well, we always wait too long. Yeah.
To see the doctor, right? Okay, so tell me about your locations, your staff. I understand you have a lot of staff. You have a call center.
Correct. Yeah. Well, we've grown quite a bit. Right now, like we have 3 locations. We have one on George Dieter, one on Dyer, and on the west side on Castellano. We are currently looking at possible another location in Castellano, and maybe in the future sometime in hopefully Horizon. But for right now it's 3 locations, and I have 3 great doctors that are my associates. Okay, they're phenomenal. But honestly, our staff is great too. I mean, without our staff, we are nothing, and we have probably about 35 employees at this point.
Oh my goodness.
And so all our employees are very good. All our medical assistants are great, and we really don't function without them, honestly.
Yeah, they are that first person you meet in that frontline employee is so important.
Yes.
Before we get into the doctor's room, right?
Yeah, absolutely.
The exam room. So to make an appointment, can we call a number to the call center so we can make an appointment? And then depending on where we live, I think would be a good idea, don't you think, Doctor, for our viewers?
Absolutely. Well, you can always reach us at 915-532-3721. That is our main location, but we have operators there, and you just have to tell them which location you want, and they will take you to that location.
Okay, super. And does it take a long time? Is there a long waiting list to see the doctor?
We try to get, especially emergency, we get them in right away. If you're a new patient, we try to get you in as soon as possible. We try not to wait more than 48 hours if possible. And if it's an emergency, like I said, just call us right away and we'll get you in as soon as possible.
I've seen your commercials on the main channels and all your staff and it's really good to know that whether it's foot care, a PCP that we need, or a specialist, there's always good medical help here in El Paso for our community. And any last message you want to say to families that have elders? Don't let it go too long, get the attention that they need, because Medicare covers much of your services.
Correct. Well, that's like I said earlier, pain isn't a normal thing, okay? So if you're hurting, please come on in. If you're diabetic, please give us a call, okay? Because prevention is so important in this town.
Yes.
And so if you have any foot problems, we're here for you. We're the Foot Institute, and I'm Dr. De la Rosa, and we have all our guys to help you.
Do you have a website as well that people can visit?
Sure. I'll have 2. It's the same, website, but basically we have 2 ways to get there. The first one is the Foot Institute. You have to add the in front of it, okay? Thefootinstitute.com or feethurtep.com.
That's easy.
Yeah, that's a lot easier. I know.
feethurtep.com.
Correct.
Very good. And so I think we've covered everything, Doctor. Just to thank you for taking the time. I know you're busy. I can imagine trying to keep us all healthy and have our feet healthy. And I've discovered how important my feet are. Oh my gosh! When you start hurting, they say, "Hey, listen to me."
Absolutely.
Listen to me.
You better listen to them. Yeah.
Thank you, Dr. De la Rosa.
It's my pleasure.
Efren De la Rosa here from the Foot Institute.
Yes,
and
ma'am.
Thank your staff for bringing you as well.
Okay, absolutely. Thank you.
Good luck to you. And of course, we wish you luck on those new clinics that you want to start, new locations. And we'll be back. Actually, we'll be back next week. Thank you for being here on Mature Living. See you then.